Today, we're talking about tummy tuck versus liposuction. I'm using this picture of a before and after of a liposuction to discuss this topic. Now, the tummy tuck and the liposuction are both procedures that improve the abdomen and the waist. The tummy tuck is more about making a flat stomach. The liposuction is more about making a curvy waist. Now, this person had a lot of extra skin on the abdomen, but was able to have liposuction because the abdominal wall muscles were strong. When I examined this person's abdominal wall, I could feel that the muscles were strong. So since the muscles are strong, liposuction became an option. If the muscles were weak, and usually if the upper part of the abdomen is sticking out a lot more than the bottom, then that is a sign that the muscles of the abdomen are weak. Then you would need to do a tummy tuck to actually tighten those muscles. And what you do with a tummy tuck is you'd sew the muscles together and then invert the muscles. But this person's abdominal wall was strong, so even though she has a lot of loose skin and the stomach is protuberant, the liposuction became an option. So with this patient, I liposuctioned the inner thigh, the abdomen, back, flank, and arms. And I was able to get the skin to contract from this to this. So now you can see where that tight abdominal wall is. So the point is, just because the stomach is round, just because the skin is loose, doesn't necessarily mean it has to be a tummy tuck. Liposuction is an option when the abdominal wall is strong. Now, in my mind, when you do a liposuction correctly, the skin will contract. It's not really a question of if, it's a question of how much. But you can see in this after, the skin of the front of the abdomen is tighter. The skin of the flank is tighter than it was before. You can see the wrinkles. Now the wrinkles in the back have to do with the skin being, the length of the skin this way being longer than the length of the bone. Now if you get the skin to contract and tighten, now if we can get the length of the skin and the length of the bones the same, now we have more of a flat, smooth back. So back rolls are really about how stretched the skin is, not really the fat of the back. If the skin is tight, then we have a smooth back. If the skin is loose, now we have the wrinkles. But you see how the liposuction tightened that back. The liposuction tightened the skin of the abdomen. Again, we have a bones this size and a skin that size. The liposuction allows that skin to contract down to the bones. Now, when you do a tummy tuck, you have the skin this wide, the bones this wide. You cut the bottom off, the skin is still loose. So that's what liposuction does that a tummy tuck can't. So liposuction is about the skin contracting. The tummy tuck is about tightening the muscles. This person had a liposuction because the abdominal wall was strong. So it doesn't always have to be a tummy tuck. Expand and push the liposuction. I think the curves is a much better look than the flat stomach. The curves of liposuction is a better look than the SpongeBob flat stomach.